This instructional video demonstrates the Hughes Repair technique for closing midline abdominal wounds. The Hughes Repair should be performed using single nylon as per the protocol. Start at one end of the wound by taking a large bite of at least 2 to 3 cm of the fascia going from outside to inside. Your next bite should be smaller, approximately 1 cm, going from inside to outside on the opposite side of the wound. Pull through the excess nylon. The next bite will again be small, back on the side you first started and a little further down the wound, going from outside to inside. This is followed by a large bite from inside to outside, taking again 2 to 3 cm of tissue opposite where you took the first large bite. Be careful to avoid tangling the suture. Now reverse mount your needle and take a similarly large bite on the same side of the wound, going from outside to inside. This should be positioned around 2 cm further along the wound from the last bite. Going from inside to outside, take a small 1 cm bite of the fascia on the opposite side of the wound. This should be around 2 cm along the wound from the previous stitch. Crossing back to the other side, take another 1 cm bite, going from outside to inside, again pulling through the slack. The final stitch is another large bite, going from inside to outside, coming out around 4 cm down the wound from the starting stitch. Now clip the two ends together and cut the suture. Each half of the Hughes Repair stitch essentially should be a mirror image of the other. Now move a centimetre or two down the wound and start again from the same side. The order of stitching should be outside to in with a large bite, then a small bite going from inside to out, a small bite outside to in, and then a large bite inside to out. This is then repeated in reverse once the needle is reversed, mirroring the first 4 stitches. Repeat the Hughes stitch as many times as necessary to cover the length of the incision. 1 Hughes Repair stitch per 5 or 6 cm of wound is typical. Pull the loose strands of suture more snugly and place the ends in clips to keep things tidy. The closure should be completed using a standard mass closure technique with a 1 loop PDS over the top of the Hughes sutures. Take care to ensure that you do not get tangled with the existing suture line. As you pass each Hughes suture with the mass closure, pull the nylon snug and tie the ends, first making sure that no bowel has been trapped. Now continue along the wound with the PDS mass closure. Once again, as you pass the Hughes stitch with the mask closure, first check for bowel and then tie the knot after snugging the suture firmly, taking care not to snap the nylon. Once you have reached the midpoint of the wound, start with a loop PDS from the other end, proceeding in the same fashion. This is how the final repair should look. The Hughes Repair sutures should lie outside of the area that you would normally place the mask closure sutures. For more information on the Hughes Repair and the HART trial, visit www.welshbarbers.org and follow the links.